Respiratory viruses are spreading once again. The CDC says millions of Americans are sick across the nation. Hospitals and doctors' offices are at a high level right now. Hate hearing about that, especially in the winter months. Our medical expert, Dr. Samir Islam, has some tips on staying healthy this time of year. Thanks so much for joining us.
Thanks for having me on.
Okay, RSV, flu, COVID again. Those are kind of the biggest concerns right now here and across the country. So what is it in Lubbock that's giving folks the most problems right now?
So it's similar all across the country, even in Lubbock as well. Mainly it's RSV and flu. These are the times when you have the highest incidences, not only in the country, but also in Lubbock. Luckily, though, COVID has been a little bit less than it has been before, mainly because of the immunity and also the fact that we also have the vaccines that are out as well.
Okay, that is good news. Talk a little bit about those RSV, flu, COVID. What kind of symptoms are you seeing first all before they have to go to the doctor or maybe go to even the hospital if it gets really bad?
It's a lot of upper respiratory tract infections, cough, congestion, and fevers. These are the initial symptoms that we see, and a lot of people are having this right now. And this is the time when if you have these symptoms, you want to make sure you see your doctor because it can be very confusing exactly what you have. It could also be RSV, it could be flu, or it could be COVID. So that's why it's very important when you start to have these issues or these symptoms to immediately see medical attention so we can see exactly what's going on and get that taken care of.
And let's talk a little bit about the doctors too. How has it been keeping a lot of doctors busy? Are the doctors' offices busy right now? Urgent care?
This is a busy time for all healthcare providers, both in primary care, urgent care, the emergency room, and the hospital as well. The wintertime commonly is the time when all these viruses come out and they infect so many different people.
Talk a little bit about the emergency rooms and urgent care. It seems like emergency rooms are always busy with a lot of different things. Are people waiting hours to be seen, or are they kind of calmed down? Because I know sometimes that can happen.
Yeah, that's the problem, is that a lot of people are going to the emergency room for some of the issues and symptoms that may not be right in the right setting. So if you have minor symptoms, cough, congestion, not feeling very good, either seeing your primary care doctor or even going to an urgent care would be the best option. You want to save the emergency room for real emergencies, shortness of breath, dehydration, and symptoms like that.
And talk a little bit too about being indoors. You know, it's cold. It's very cold right now. So that's probably the reason why these spread so much right now too, right?
That's exactly right. You're indoors, you're around people who are close by, people are maybe not as washing their hands as much or as often, and so this is a ripe time and the ripe environment to get these infections and to make people more and more sick.
Okay, so wash your hands like you said.
Yes.
Anything else that we should do? Not share drinks, all the normal things that we know that we talk about.
It is so simple, it is easy, but these things make a difference. Wash your hands, cover your cough. If you're sick, go see your doctor and stay away from your friends and family so they don't get sick as well.
Okay, Dr. Islam, we appreciate it. Thanks so much for being here.
Thanks for having me on, I appreciate it.